So we talked about barriers before. We should also talk about ways to overcome those barriers. And there are many ways that we could kind of think about, increasing awareness to PrEP. And some of it is this. Some of this is doing this with providers. Some of this is doing this through public service announcements, through what New York City has done. We're putting this on the subways and on buses, having a broad educational campaign. And I think that's great. We got to get more providers and primary care providers involved. And that really has taken off, I think, over the last 5 years. How to get people to understand their risk perception? Well, it starts with some of the sexual history taking and sexual health that can be integrated and should be integrated into general primary care, just as Letitia went over. Stigma is a tough one, especially where we work here in the South. That certainly will take some work, understanding from our own point of view as providers where this is coming from, how to help support our patients, how to improve communication and not be judgmental or have our clinics be judgmental, that only add and fuel to stigma. Certainly, we could talk about bias and distrust of the healthcare system. I think a good thing for many of us who work in HIV, whether it be prevention or in treatment, is that we have generally better trust and better relationship with our patients than many other sectors of the healthcare system. But we can always work further on this and make sure that we understand more about our biases and where we're coming from. Access to medical care, that's really important, especially in rural areas where there isn't as many providers or clinics or even pharmacies where PrEP could be administered or accessed. And then financial assistance. This is a big deal, especially for states, especially in the South, that have an expanded Medicaid, and thus there are some obligations that people have that are serious barriers to being protected from HIV. And then side effects, if you ask people about some of the reasons they don't want to stay on PrEP or don't uptake PrEP, sometimes it is side effects. So we shouldn't disregard that, and certainly providing education about that so people understand if they have nausea, it's probably short-lived. And then as we talk about injectables, what the side effects are from that modality.